Are you worried about losing your vision? You might be surprised to know that your eyelids can steal your vision slowly over time without you realizing it. So do this for me. Take your fingers and pinch your upper eyelid skin. If you can pinch some skin away, you might have something called hooded upper eyelids. This is something that can slowly block your vision over time, and you don't actually know that it's happening because your brain compensates without really asking your permission first. You can do some weird compensations like raising your forehead all the time, which can give you headaches, or tilting your chin back, which can give you some neck pain. In this video, you'll learn what you can do about hooded upper eyelids, and depending on how bad it is, this can cost anywhere from $100 to fix to $10,000 to fix. The crazy thing is, the worse your eyelids get, the cheaper it actually is to fix it. Let me explain. You might not even realize this problem because your brain overcompensates for this without you even knowing it. So how do you figure out if A, you have a hooded upper eyelid, and B, if it's bad enough that it's affecting your vision? Keep watching until the end of this video and I'll explain how we figure out if it's blocking your vision, what can be done about it, and if insurance will cover it. People think that upper eyelid surgery is just for those people who are trying to improve their appearance. However, I take care of a lot of folks that do it just to improve their vision. Think about it this way. If you have hooded, heavy upper eyelids where that skin is coming in front of your eyelashes, it's gonna limit the amount of light that's getting into your eye, which is gonna dim your vision. So if you have that skin taken away to where you don't have that heaviness there, it's gonna bring more light and it's gonna improve the quality of your vision. A lot of folks even use their forehead to compensate for having droopy upper eyelids, and that actually compounds the problem to where you might need 2 surgeries instead of 1 to fix this. Because if you constantly raise and lower your forehead because you're squinting when you go outside and raising your forehead to see, it's gonna stretch this part of your body. And the more that that area lengthens, then we actually have to go in and pull that area up in addition to trimming the upper eyelid skin in order to get you to see better. So keep watching this video and I'll explain why. I'm an eyelid surgery specialist and I've done thousands of these surgeries, and it's really improved the quality of life of my patients. Now for the other side of the coin. You're probably thinking in your head that this is the type of surgery that Kenny Rogers or Mickey Rourke or pick any bad celebrity eyelid surgery had, and you're thinking, that is definitely not the outcome I want. But I'm here to tell you that that's wrong. That is not the point of the surgery, and if you go about it in the right way, you'll be able to avoid that kind of outcome. People seem to think that Kenny Rogers had some sort of obsession with cosmetic surgery, but in fact what he had was he took something that was his natural look, which was hooded upper eyelids, and he completely changed it by taking away all the skin. If you follow the steps that I give you here, you'll be able to avoid that outcome and keep your natural appearance with this surgery. I'm gonna give you one tip here. There are surgeons who specialize exclusively in this type of surgery, and they are called oculofacial plastic surgeons or eyelid plastic surgeons. I am one, and if you wanna find one near you, go to oculofacialsociety.org. I can't guarantee that everybody in my field thinks about this the exact same way that I do, but you need to have an expert taking care of you when you have this surgery done if you wanna avoid that kind of outcome that you're worried about in your head. You can even have this surgery without others necessarily noticing anything is different, and it can still improve your vision. The surprising thing is that the surgery can even be covered by insurance in some cases. And if you keep watching, I'll tell you how I do the surgery and when insurance will cover it and how much it typically costs. So this is how upper eyelid surgery is done. The interesting thing is the most important step of the surgery happens before I even pick up a scalpel or a stitch. The most important step of the surgery is when I grab a marker and mark off how much skin I'm going to remove. The reason is because all of us need to have extra upper eyelid skin on our upper eyelids to help us close our eyes when we blink or when we sleep. Think about it this way. You've got to have extra upper eyelid skin for when you're trying to blink or close your eyes. And even though that sounds obvious, it's not obvious to everybody. The upper eyelid goes down to meet the lower eyelid when it blinks or closes, and so you have to maintain a slack line in the upper eyelid in order to keep a safety margin with the surgery. Another way of saying it is this. Before surgery, what I do is I have people sit up and I have them close their eyes. And I pinch the extra upper eyelid skin, and I pinch and mark, and I stop just short of the point where I actually pull their eyelids open. If you do it that way, you'll keep a safety margin behind where there'll still be enough skin left behind for you to be able to close your eyes eventually after surgery. If you're not careful or you go to a surgeon that's not as experienced, they might not leave that safety margin behind, and that's when you really run into problems where you can't close your eyes after surgery. Some patients want to even have more of a hooded appearance after surgery because they really don't want anybody to know they had something done, and in that case I can leave even more skin behind to leave that hooded appearance there. So the surgery part is where the years of expertise comes in terms of what to do and how to do it. I can tell you it's not just about removing skin, it's about what you do under the hood and what you do with the muscle and the fat that underlies everything in order to create that beautiful appearance that you're hoping for, whether you're doing the surgery for your vision or you're doing it just for appearances. If you want to learn specifically how I approach some of these finer points, watch some of the other videos on my feed. After the surgery is done, I finish up by putting some stitches in. Those stitches can be permanent, where I have to take them out a week later, or dissolvable, where they just go away on their own. In experienced hands, this surgery should take 30 or 40 minutes. If you go to a surgeon and they say it's going to take like 90 minutes or 2 hours, then that could be a red flag that maybe they don't do this very often, or they're not very confident in how they do the surgery. So now let's talk about whether your insurance will cover this. So first of all, why would insurance pay for upper eyelid surgery? Well, in some cases, it is actually medically necessary because when the upper eyelid skin or the eyelashes are coming in front of your vision, it's going to affect some of the things that you do on a day-to-day basis, and you might bang into cabinets in your kitchen without knowing it, or if the hooding is especially gathering on the outside, which it often is, it can affect your blind spot while you're driving because you might just not have that quick reaction time when you're trying to look over your shoulder. So some insurances, but not all, can cover the surgery if you meet their criteria. Try this to figure that out. Have someone take a picture of you where you're standing in front of a white wall. Make sure you're not raising your chin up, keep your chin level, and make sure you're not raising your forehead to see. Relax your forehead by closing your eyes like you're sleeping. Open your eyes naturally just with your eyelashes, look straight ahead at the lens of the camera, have somebody snap that photo, and then take a look at the photo. And if the upper eyelid skin or eyelashes are covering up that top half of the colored part of your eye, then you might be a medical candidate for the surgery and you should consider getting checked out. I can tell you from over a decade of performing this surgery, it is incredibly satisfying to see patients feel like they can see better, get more light in, and there's a super high rate of satisfaction with this surgery, and it is a very safe surgery in experienced hands. So how much does this all cost? Well, this one is going to surprise you. The more upper eyelid skin you have, the cheaper the surgery is. Let me explain. The more skin that you have that's gathering there that I have to lop off at the time of surgery, and sometimes that can be up to like an inch of extra upper eyelid skin, the more skin you have, the less the surgery can cost. The reason is that if you meet medical criteria for insurance to cover this surgery, your copay could be as little as $100. However, many of my patients do not meet medical criteria, and you have to come to my office to get evaluated to determine that. And when they don't meet medical criteria, a lot of patients still want to have it done because they know it's going to help them see better, feel better, or just look at themselves in the mirror and not see that appearance that they might perceive as aging that they don't necessarily want to see. And that's when the surgery can sometimes cost upwards of like $10,000. Sometimes what we have to do is we have to reset the forehead height in addition to trimming the skin. Let me give you an analogy for why that's the case. Think about like a curtain in your house, and imagine that the curtain is kind of bent at the edges of it. And imagine that the fabric on the curtain is stretched out, so you've just got fabric all over your floor. Well, it wouldn't make sense to just trim the fabric all over the floor and assume that it's going to look good. You've got to straighten the bar of the curtain, which means resetting the brow height so that your eyebrows are kind of sitting on your bone there, and fixing the curtain fabric by trimming some of it, which means taking some of the extra upper eyelid skin. That's going to give you the best outcome, and that's why sometimes you need 2 surgeries to fix this to kind of reset your natural appearance and not have that hooding gathering over towards your temples. So if you'd like more information about what exact criteria insurance used to cover this or other procedures you can have at the same time as this, like lower eyelid surgery, check out some of the other videos on my feed, and I hope that you found this video useful.